Committee on the Judiciary. I'm now going to call us to order. We are waiting for one more member in order to establish a quorum, but I do note we do have a member here who's ready to proceed. So we'll hope that in the next minute or two we will have at least one more member of the committee so that we can establish that quorum. But at this point we will start as a subcommittee. I would like to indicate for those of you who are here to testify that we have 3 items now on the consent calendar. File item 1, which is SB 28 by Senator Wieckowski, item 5, SB 474 by Senator Wieckowski, and item 9, SB 785 by Senator Morell. In addition, the following item has been pulled from today's agenda. Item 4, SB 385 by Senator Hueso. So if you are here on any of those bills, unless you find this just a fascinating committee, you're free to go because those matters have all been taken up and addressed. And other than that, we will now turn to our agenda and again start off as a subcommittee. File item 7 is Senator Hernandez, SB 672, and if you would like to step forward, Senator, we'd like to welcome you. And the method that we use here is we'll have to the extent there are witnesses, 2 witnesses in support, and then we will ask any additional witnesses to step forward with their name, affiliation, and their obvious indication of support. Then we will have the opposition, 2 witnesses, 2 minutes each. And then the opposition to step forward with their name, affiliation, and their objection, or specifically their position in support or against the bill. And that will be the extent of the testimony, subject to questions from the members, should there be any. So we're on file item 7, SB 672. Senator Hernandez, good afternoon.
Good afternoon, Madam Chair and members. Thank you for allowing me to present the bill. First of all, I'd like to start off by accepting the committee's technical amendments, which clarify that this bill applies discovery protections to all pharmacists and not just those operating in the pharmacy. And I'd like to thank you and all the work your staff has done as well.
Great.
This bill adds pharmacists to a list of healthcare professionals who are peer-reviewed proceedings and records are protected from discovery in civil litigation. This bill is I authored, which as you know is authored at SB 493, which acknowledges pharmacists are healthcare providers and expanded their scope of practice. Under 493, pharmacists will have an expanded role in the provision of direct patient care in hospitals. The lack of protection for pharmacists' peer review is problematic because it precludes pharmacists from engaging in this much needed activity as other professionals do in the peer review process. The records associated with pharmacist peer review should be given the same protection as other health professional records, such as I mentioned, acupuncturists, marriage and family therapists, licensed clinical social workers, and professional clinical counselors. There is no opposition, and members, I respectfully ask for an aye vote.
Thank you. Witnesses in support.
Good afternoon, Madam Chair. My name is Megan Maddox. I am with the California Pharmacists Association. And we represent pharmacists across the state in all practice settings, which include pharmacists in community pharmacies, as well as pharmacists in long-term care facilities, in hospitals, and clinical settings. And currently for our pharmacists that are in hospital or clinical settings, they typically provide more direct patient care services beyond that traditional drug dispensing role. And this generally involves working under a physician or a health system protocol or under a collaborative drug therapy management agreement to actively manage their patients' drug treatments. And it's important for pharmacists who are engaged in this type of clinical activity to be able to establish their own peer review bodies and participate in interdisciplinary peer review proceedings, specifically so that they can promote patient safety and advance quality patient care, as well as be able to do this in a safe setting that establishes open and honest communication. And so SB 672 specifically adds pharmacists to that list of healthcare providers who already have the peer review protections in place. Pharmacists are already recognized as healthcare providers under state law, and so this is just to ensure that they get the same peer review protections as other healthcare providers do. And so we ask for your aye vote today.
Thank you very much. And before we proceed, we have a quorum, so let's go ahead and establish that quorum. Madam Secretary, please call the roll.
Jackson?
Here.
Jackson here. Morlock? Morlock here. Anderson? Anderson here. Hertzberg? Leno? Leno here. Monning? Wykowski?
All right, we have 2 people present and 2 people here, and I guess that makes enough people to get started as a committee. Next witness.
Thank you, Chair and members. Jonathan Nelson on behalf of the California Society of Health System Pharmacists. We represent primarily hospital pharmacists. And for the sake of time, I just want to emphasize a point that my colleague made, that as pharmacists increasingly move towards clinical and patient-oriented roles, it becomes increasingly valuable for them to participate in the peer review process. This bill will help incentivize that, and for that reasons, we are in support. Thank you.
Thank you. Are there any witnesses here in support? Any additional witnesses in support? Any witnesses in opposition? All right, bring it to the committee. Any questions from the committee? Senator Leno.
Senator Hernandez, as you mentioned in your opening, you made reference to your SB 493, correct, which further expanded the authority of pharmacists. This seems like such a good idea. Do you know how it is that we haven't had this before the legislature before?
Well, as you know, various professions, and pharmacy in particular, has changed dramatically in their education, whereas now, it's not only a prerequisite to get a bachelor's, graduate with a postdoctorate, they have a lot of patient encounter as well as a residency program. So they're now moving into more direct patient care, whereas in the past it was just dealing with dispensing of medications. So now that they are more into patient care, they need to have those same privileges, but more importantly, the ability to have a peer review like their counterparts, whether it's medicine, optometry, all the other health professions that are afforded as well. So the profession has changed dramatically, but mainly due to education. That's why it hasn't come up before.
So it's a natural follow-up to 493.
Yes, and as you know, 493, which was signed into law 2 years ago, and through the regulatory process is just starting to come into effect, where pharmacists now, advanced practicing pharmacists are now going to be out in the public seeing patients on a much more, at a much higher level of practice than they were in the past.
Thank you. Madam Chair, I move the bill.
Very well. I just have a question. This makes a lot of sense. I'm wondering, though, have there been any studies or any follow-up to see whether these measures are in fact leading to open and honest communications and have been meeting their intended purpose of improving quality going forward, or is this just something we assume? Are there studies, are there measurements that have been made to show that these are meeting their expectations in terms of improving the quality of care?
And I can address that. In Texas, they have passed legislation that has, back in, I believe, 1999, that allowed their Board of Pharmacy to allow pharmacists to engage in peer review, and it has shown that it has, with that more direct patient care beyond the drug dispensing, has improved that quality of care.
Is this something that might be considered in California so we can just kind of know that those expectations are being met? I know Texas is Texas, but I wonder, is this something that the Pharmaceutical Association would be willing to conduct, or whether the group that oversees the pharmaceutical or the pharmacies and pharmacists in the state, or is this something you think is just not necessary?
I think that if you look at a peer review as a whole for all professions, if you're going to ask it for pharmacy, I think we should ask that question as a legislature for all professions to find out if, in fact, that they're doing what they're supposed to do, and most importantly is protecting the public. Maybe that's something OSHPD might be able to do, which studies and looks at different professions. That's not something I was considering, but
Well, I don't mean to point out pharmacists. I just we make certain assumptions that these things are helpful and productive, and I'm just, perhaps it might be a good idea to, at some point, gauge whether or not they are being successful or their level of success. There might be things we can do to improve upon them or not.
I would just add that under current law, under the Business and Professions Code, Section 4125, pharmacists do have what's known as the Quality Assurance Program. And any pharmacists who document any medication errors are deemed protection over those documents. But for pharmacists who are participating or practicing outside of actual community pharmacies, this is what the protections that they need under the evidence code. And so it's specifically for those pharmacists who are practicing in hospitals or in clinical settings that need these type of protections, as well as to ensure that they engage in clinical peer review, and they're needing that legal protection in order to engage in this type of practice.
Right, and I know that was the purpose of this bill. I have no objection with that. I'm just actually following the train of thought that we make assumptions that this peer review is working, and I'm just wondering whether there's any data that demonstrates that. And apparently we don't have that in the state for pharmacists or these other entities. Just a question, perhaps something we might look at.
Answer, so.
Yeah, okay, I appreciate it. Any other questions? All right, we have a motion. Senator Hernandez, would you like to close?
That's when I vote, Madam Chair.
All right. Always very pithy and to the point. All right, Madam Secretary, this motion is due pass as amended to the Senate floor. Please call the roll.
Jackson?
Aye.
Jackson, aye. Morlock? Morlock, aye. Anderson? Anderson, aye. Hertzberg? Leno? Leno, aye. Monning? Monning, aye. Wachowski? Wachowski, aye. 6-0.
6-0. We'll keep the roll open for our absent member, and thank you very much, Senator and witnesses.
Thank you.
And Senator Huff is here without tie today, so we're being quite casual.
Thank you for noticing. Yes,
I think an ascot would be acceptable.
I'm right there. All right.
And I'm sure there are many ties as well, which would go with a neutral outfit like that. You could wear almost anything.
As someone pointed out, my European shoes. I'm very comfortable today. Thank you for noticing.
Excellent, excellent. All right, Senator, this is file item 8, SB 738, an ephedrine measure. One of your topics near and dear to your heart, file item 8.
Thank you, Madam Chair and members. First, I'd like to accept the committee amendments offered in the analysis. And as you may recall, though we have at least one new member up here, last year the legislature unanimously passed and the governor signed my bill SB 1266 requiring extra epinephrine auto-injectors be prescribed as a standing order, ensuring the life-saving medication can be on hand in public schools. I want to share some good news on this policy because sometimes we enact things and we don't really follow up on it. But my office has recently been informed that in San Marcos School District, medication was used and potentially saved a life down there. So this policy is important. It's working. When SB 1266 took effect, many physicians began raising questions about issuing the prescription, citing liability concerns. Unlike normal prescriptions made out to a specific individual who physicians have a patient relationship with, a standing order for epinephrine will be made out generically so the school can keep it on hand. Physicians have stated that having liability coverage in the code, similar to what they have for an automated external defibrillator, or AED, and opioid antagonists, and I'm not even sure how you say this, I believe it's naloxone hydrochloride, it will help ease their concern. Recent data from the California School Nurse Organization shows that many schools who are trying to implement SB 1266, which took effect January 1st of this year, cannot because they cannot obtain the necessary prescription. SB 738 will provide limited liability protection for prescribing physicians writing standing order prescriptions in order to comply with SB 1266, which is the stock epinephrine in schools, and is similar to current law as it relates, as said, to the liability for AEDs and opioid antagonists. Most recently, language like this was in AB 635, Amiano, which passed out of this committee with bipartisan support. I should also mention that other states, Nevada and Virginia, to name a couple, with similar stock epi laws also provide limited liability coverage for physicians. I have some witnesses here to speak to the need for the measure, starting with Dr. Travis Miller here on behalf of the sponsor, California Society for Allergy, Asthma, and Immunology. He'll be followed by a school nurse, Melissa Locketts.
Thank you very much. Witnesses, 2 minutes each, two on each side.
Thank you. Thank you, Senator Huff. That was an excellent introduction. As he mentioned, this is a prescription which is not for a specific patient, which has concerned many of the providers that I've spoken to. I'm here today on behalf of the California State Allergy Society, which has 150 physicians that prescribe a lot of EpiPens. And more than 10 of them approached me and actually said that they had concerns regarding liability when they discuss it with their malpractice carrier. So I think that's quite an important piece of information. I think Heidi will talk about the fact that there's an imbalance. I've actually had conversations with Placer County Health Officer, Dr. Oldham, about this issue, and as he mentioned to me, and I think you'll hear from Melissa, it's difficult for schools to get their prescriptions. It would be optimal if school nurses had a variety of resources to go to as far as these prescriptions, to obtain them, and the education that's necessary to support their use in schools. So I think it's an excellent add-on bill to 1266. I think it will make it safer for students and for public health. Thank you.
Thank you. Next witness.
Hello, Madam Chair and committee members. My name is Melissa Locketts, and I'm a school nurse. Thank you for passing SB 1266. Having stock epinephrine autoinjectors is necessary to do our jobs well because school nurses supervise the health concerns of students, including those with life-threatening allergies. I am relatively new to school nursing, but in my 20 years in the medical field, I've worked in military and civilian medical systems, including clinics and hospitals, and specialties ranging from emergency medicine to employee health. School nursing is the first time that I have not had an assigned physician or medical director that I can go to when I need to. It is because nurses cannot write prescriptions or standing orders that SB 1266 has required many schools to find physicians to write orders on patients or students who they do not care for or supervise. The orders the physicians are asked to write are not just for the medication, but also for a standard protocol of how to act in this type of emergency. While the schools are then charged with training the staff and the implementation of the orders, it leaves the physicians wondering what their liability is if the school does not implement or train well. School nurses need to be able to partner with physicians and not have them concerned with liability. We need their assistance and we need their support. I am fortunate to have Dr. Miller's support. However, there are many school nurses statewide that have been unable to find a physician who will sign. Here are 5 statements from fellow school nurses who could not be here today. 1, it is unfair to some schools that they are not lucky enough to have relationships with physicians. 2, my county public health officer is awaiting permission from county legal. He says that he will know if he can sign in a few more months. 3, a physician who has written our prescription for the past 10 years is now concerned that SB 1266 has opened him up to liability. He will no longer sign. 4, I have tried multiple avenues and been turned down by physicians citing liability concerns. 5, I've had success with one physician, but he stated that he could only take on the liability of one school and not an entire district. All of these nurses want to comply with the law and protect their students. It is critical that physicians not hesitate to write these orders. It is known that epinephrine saves lives and only physicians can write the orders. Please support SB 738 and provide the physicians the security with language that limits their liability.
Thank you very much. Very briefly.
Hi, Kat DeBerg with the Health Officers Association of California, the physicians in each county and city who oversee public health, and they're being asked to sign these orders but being told by their county councils and their risk managers that the liability risk is real. So we think this bill will go a ways to solve that concern.
Thank you very much. Any other witnesses in support? If you would just, do we have a mic? Or, all right, we'll have to give him a place to sit, so if you could go ahead, take a seat.
Very briefly, Daniel Savino, Association of Regional Center Agencies. This is a very concise and precedent-based change to law to expand access. We view it as a very positive thing. I've appreciated Senator Huff's leadership on this issue over prior sessions and strongly urge support.
Thank you. Anyone else in support? Any opposition to this bill? Seeing none, any questions from the dais here. Any questions? I'll move it. Motion by Senator Morlock. Did you have a question, Senator Anderson?
Yes. I'd like to be added as a co-author. It's an outstanding bill.
Thank you.
Okay. Any further discussion? All right, we have a motion. Madam Secretary, this is a motion do pass as amended to the Senate floor. Please call the roll.
Jackson?
Aye.
Jackson, aye. Morlock? Morlock, aye. Anderson? Anderson, aye. Hertzberg? Leno? Aye. Leno, aye. Monning? Monning, aye. Wachowski? Wachowski, aye. 6 to 0.
All right, 6 to 0. We'll leave the roll open for the absent member. Thank you, Senator Huff. Hope you find that tie. All right. Next, we will take up file item 10, AB 60 by Assemblymember Gonzalez. Good afternoon.
Thank you, Chairwoman, members. In 2013, we passed and the governor signed AB 1159 to prevent immigration attorneys, consultants, and notarios from luring people into paying money prior to the enactment of Immigration Reform Act services passed by Congress. Of course, unfortunately, immigration reform never was passed by Congress. AB 60 is a consumer protection measure which will extend those existing protections to about 1.5 million Californians that may be eligible to receive relief under the President's executive action if it ever comes about. A Texas's federal judge's injunction of DAPA and DACA creates a large window of opportunity for predatory practices in our state. It's unethical, we believe, to charge consumers for a program that has never been fully implemented and may never come to fruition. However, this bill will allow services with independent value permitted under the law, such as services to prevent removal from the United States and achieving post-conviction relief. All this bill does extends the same protections that we created under AB 1159 to individuals who now would like to seek relief and attorneys who would like them to seek relief under a possible DACA or DAPA provision, but unfortunately is not in existence. So it would prevent the taking of money before such an action could become final. I respectfully ask for an aye vote. I have a couple people to testify in support today.
Very good. Thank you. Good afternoon.
Good afternoon. Thank you. My name is Leima Murtaza, and I'm here on behalf of Asian Americans Advancing Justice Los Angeles, the nation's largest legal and civil rights organization for Native Hawaiians, Pacific Islanders, Asian Americans, and other undeserved populations. Advancing Justice has often heard instances of clients who have been scammed by unscrupulous attorneys and immigration preparers and notarios. AB 60 will provide protection to immigrant populations who have been target of unscrupulous attorneys, immigration preparers, and notary services, more commonly known as notarios. AB 60 will strengthen our current laws under AB 1159 and ensure that those who apply for the President's executive action have protection against immigration fraud. We appreciate Assemblymember Gonzalez's leadership with this bill, and we respectfully ask for your aye vote on AB 60.
Thank you. Next witness.
Hello, Sylvia Solis-Shaw on behalf of City of Los Angeles Mayor Eric Garcetti and on behalf of City of Los Angeles City Attorney Mike Feuer. California is home to nearly 4 million individuals who are eligible for either naturalization or deferred action, and nearly 1/3, so we're looking at a little over 1 million, live in the city of Los Angeles. Both Mayor Garcetti and City Attorney Feuer are concerned that immigrants will be targeted and victimized by an increasing number of scams. In fact, the City Attorney's Office has initiated a comprehensive enforcement and education campaign. We've partnered with the County Department of Consumer and Business Affairs and local legal aid organizations to address immigration scams and educate immigrants on how to best navigate the new rules and avoid being victimized. Further efforts include hosting community meetings on immigration and town hall forums to offer services to help immigrants with the application system and to educate consumers on how to avoid being scammed and to intake actual complaints. So there are lots of complaints. There's a problem out there. Specifically, we have secured conviction and full restitution for victims of a San Fernando Valley man who was the target of an undercover investigation after frequent complaints. So we fully support AB 60. We believe it will close a loophole in existing law by applying safeguards and consumer protections to immigrants seeking services under the current executive action. Thank you.
Thank you. Any other witnesses in support? Please step forward just very briefly.
Good afternoon, Sandra Palacios with the California Catholic Conference, in strong support of the bill. As you know, the church has a long history in welcoming and supporting immigrants, and we'd like to thank the Assemblywoman for her leadership on this issue. Thank you.
Thank you very much. Other witnesses in support? We have a microphone over here. If we could just have you step up with name and affiliation and obviously indicating that you are in support.
Thank you, Madam Chair. Mari Lopez with Visión y Compromiso, the statewide network of promotores and community health workers, and we're in support of AB 60.
Thank you so much. Always a pleasure to see you.
Alma Garcia, Paso Robles, promotora. Apoyo la ley.
In support. Thank you.
Hilda Pulido from Promotoras. I support this bill.
Thank you. Next, we'll go side to side here.
Lupe Núñez, and I'm from the Bay Area, and I support AB 60.
Thank you, Lupe.
Dora María Pérez from Santa Barbara, Visión y Compromiso.
Always a pleasure.
Lourdes Ochoa, promotora de Hayward.
Thank you.
María Ríos de Santa Bárbara, Misión y Compromiso.
Thank you.
Julieta Martinez, promotora, Bay Area. I support this bill.
Thank you.
Olivia Porras from the Central Coast, and I support this bill.
Thank you.
Nora Vigil represented the Committee of the Bay Area, Contra Costa, Visión y Compromiso.
Thank you.
Mayra Pérez for Visión y Compromiso en Padres Unidos, and I support this bill.
Thank you.
Guadalupe Pérez, promotora de salud, Bay Area. I support ABC 60.
Thank you.
Julio Mora de San Luis Obispo, promotor.
Thank you, sir.
Julissa Gutierrez from Área de la Bahía. I support them.
Thank you.
Rafael Santos from Lompoc. I support it.
Thank you. All right. Any other witnesses in support? Witnesses in opposition? Good afternoon.
Good afternoon, Madam Chair and members. Ignacio Hernandez on behalf of the American Immigration Lawyers, actually various California chapters of the American Immigration Lawyers Association. A couple of things. AILA lawyers are the attorneys who represent the very individuals that AB 60 is seeking to protect. So the good news is that we have a shared goal in protecting individuals from fraudulent behavior, bad actors. Our position on the bill is really based on two things. One is there's some language in the bill that we think needs to be updated and changed to more accurately reflect certain legal terms, which would actually strengthen the bill. We've had some discussions with the author's office, and we're hoping that those will continue so we can fix those, and the next witnesses will explain a couple of those. The other kind of category that we're concerned with is just providing greater clarification as to allowable services for attorneys. We're concerned, we want to ensure that attorneys in California there's not a chilling effect on them from providing certain services and the timing of certain services under the restriction of advance payment so that those individuals who may be able to take advantage of legal avenues that are created by executive order will actually be able to be helped. And just for example, there's language in there that talks about whether or not advance payment can be accepted upon adoption of a regulation or upon our announcement of a regulation or enactment of a regulation. And that could actually be a big difference in terms of 60 days or 90 days or a little bit longer, time that's really necessary for folks to prepare. So it really falls in those two buckets, and I'm going to defer to our experts to kind of explain a couple of those pieces. And I do want to thank the author for taking the time and author staff for talking to us over the last few weeks, and hopefully we can continue to try to work this out going forward.
Ready? Thank you.